Certainly. Here are some common respiratory diseases. Asthma. Asthma is a chronic condition characterized by inflammation and narrowing of the airways, resulting in symptoms such as wheezing, shortness of breath, coughing, and chest tightness. Chronic obstructive pulmonary disease, COPD. COPD is a progressive lung disease that includes chronic bronchitis and emphysema. It causes airflow limitation, leading to symptoms like coughing, wheezing, shortness of breath, and excessive production of mucus. Pneumonia. Pneumonia is an infection that inflames the air sacs in one or both lungs. It can be caused by bacteria, viruses, or fungi and leads to symptoms like cough, fever, chest pain, and difficulty breathing. Bronchitis. Bronchitis is an inflammation of the bronchial tubes, which carry air to and from the lungs. It can be acute or chronic and is often associated with a persistent cough, mucus production, chest discomfort, and shortness of breath. Influenza. Flu. Influenza is a highly contagious viral infection that affects the respiratory system. It causes symptoms such as fever, cough, sore throat, body aches, fatigue, and nasal congestion. Tuberculosis. TB. Tuberculosis is a bacterial infection that primarily affects the lungs but can also involve other organs. It causes symptoms like persistent cough, chest pain, weight loss, fatigue, and night sweats. Lung cancer. Lung cancer is the uncontrolled growth of abnormal cells in the lungs, usually caused by long-term exposure to tobacco smoke. Common symptoms include a persistent cough, chest pain, shortness of breath, coughing up blood, and unintentional weight loss. Sleep apnea. Sleep apnea is a sleep disorder characterized by interrupted breathing during sleep. It can lead to symptoms like loud snoring, gasping or choking during sleep, daytime sleepiness, and morning headaches. Cystic fibrosis. CF. Cystic fibrosis is a genetic disorder that affects the lungs and other organs. It leads to the production of thick, sticky mucus, causing recurrent lung infections, persistent cough, wheezing, and poor growth. Pulmonary embolism. A pulmonary embolism occurs when a blood clot blocks one of the pulmonary arteries, restricting blood flow to the lungs. It can cause sudden onset of symptoms such as shortness of breath, chest pain, rapid heart rate, and coughing up blood. These are just a few examples of respiratory diseases, and there are many more conditions that can affect the respiratory system. It's important to consult with healthcare professionals for accurate diagnosis, treatment, and management of respiratory diseases. Asthma is a major non-communicable disease, NCD, affecting both children and adults, and is the most common chronic disease among children. Inflammation and narrowing of the small airways in the lungs cause asthma symptoms, which can be any combination of cough, wheeze, shortness of breath, and chest tightness. Asthma affected an estimated 262 million people in 2019, and caused 455,000 deaths. Inhaled medication can control asthma symptoms and allow people with asthma to lead a normal, active life. Avoiding asthma triggers can also help to reduce asthma symptoms. Most asthma-related deaths occur in low and lower-middle-income countries, where underdiagnosis and undertreatment is a challenge. WHO is committed to improving the diagnosis, treatment and monitoring of asthma to reduce the global burden of NCDs and make progress towards universal health coverage. Overview. Asthma is a chronic lung disease affecting people of all ages. It is caused by inflammation and muscle tightening around the airways, which makes it harder to breathe. Symptoms can include coughing, wheezing, shortness of breath, and chest tightness. These symptoms can be mild or severe and can come and go over time. Although asthma can be a serious condition, it can be managed with the right treatment. People with symptoms of asthma should speak to a health professional. Impact. Asthma is often underdiagnosed and undertreated, particularly in low and middle-income countries. People with undertreated asthma can suffer sleep disturbance, tiredness during the day, and poor concentration. Asthma sufferers and their families may miss school and work, with financial impact on the family and wider community. If symptoms are severe, people with asthma may need to receive emergency health care and they may be admitted to hospital for treatment and monitoring. In the most severe cases, asthma can lead to death. Symptoms. Symptoms of asthma can vary from person to person. Symptoms sometimes get significantly worse. This is known as an asthma attack. Symptoms are often worse at night or during exercise. Common symptoms of asthma include a persistent cough, especially at night, wheezing when exhaling and sometimes when inhaling, shortness of breath or difficulty breathing, sometimes even when resting, chest tightness, making it difficult to breathe deeply, Some people will have worse symptoms when they have a cold or during changes in the weather. Other triggers can include dust, smoke, fumes, grass and tree pollen, animal fur and feathers, strong soaps and perfume. Symptoms can be caused by other conditions as well. People with symptoms should talk to a healthcare provider. Causes. Many factors have been linked to an increased risk of developing asthma, although it is often difficult to find a single, direct cause. Asthma is more likely if other family members also have asthma, particularly a close relative, such as a parent or sibling. Asthma is more likely in people who have other allergic conditions, such as eczema and rhinitis, hay fever. Urbanization is associated with increased asthma prevalence, probably due to multiple lifestyle factors. Events in early life affect the developing lungs and can increase the risk of asthma. These include low birth weight, prematurity, exposure to tobacco smoke and other sources of air pollution, as well as viral respiratory infections. Exposure to a range of environmental allergens and irritants are also thought to increase the risk of asthma, including indoor and outdoor air pollution, house dust mites, molds, and occupational exposure to chemicals, fumes or dust. Children and adults who are overweight or obese are at a greater risk of asthma. Treatment. Asthma cannot be cured, but there are several treatments available. The most common treatment is to use an inhaler, which delivers medication directly to the lungs. Inhalers can help control the disease and enable people with asthma to enjoy a normal, active life. There are two main types of inhaler. Bronchodilators, such as salbutamol, that open the air passages and relieve symptoms, and steroids, such as beclomethasone, that reduce inflammation in the air passages, which improves asthma symptoms and reduces the risk of severe asthma attacks and death. People with asthma may need to use their inhaler every day. Their treatment will depend on the frequency of symptoms and the types of inhalers available. Using an inhaler can be difficult, especially for children and during emergency situations. Using a spacer device makes it easier to use an aerosol inhaler. This helps the medicine to reach the lungs more easily. A spacer is a plastic container with a mouthpiece or mask at one end and a hole for the inhaler in the other. A homemade spacer, made from a 500 ml plastic bottle, can be as effective as commercially manufactured spacers. Access to inhalers is a problem in many countries. In 2021, bronchodilators were available in public primary health care facilities in half of low and low-middle income countries, and steroid inhalers available in 1/3. It is also important to raise community awareness to reduce the myths and stigma associated with asthma in some settings. Self-care. People with asthma and their families need education to understand more about their asthma. This includes their treatment options, triggers to avoid, and how to manage their symptoms at home. It is important for people with asthma to know how to increase their treatment when their symptoms are worsening to avoid a serious attack. Healthcare providers may give an asthma action plan to help people with asthma to take greater control of their treatment. WHO response. Asthma is included in the WHO Global Action Plan for the Prevention and Control of NCDs and the United Nations 2030 Agenda for Sustainable Development. WHO is taking action to extend diagnosis of and treatment for asthma in a number of ways. The WHO Package of Essential Non-Communicable Disease Interventions, PEN, was developed to help improve NCD management in primary health care in low-resource settings. PEN includes protocols for the assessment, diagnosis and management of chronic respiratory diseases, asthma and chronic obstructive pulmonary disease, and modules on healthy lifestyle counseling, including tobacco cessation and self-care. Reducing tobacco smoke exposure is important for both primary prevention of asthma and disease management. The Framework Convention on Tobacco Control is enabling progress in this area, as are WHO initiatives such as Empower and Tobacco Cessation. The Global Alliance Against Chronic Respiratory Diseases, GARD, contributes to WHO's work to prevent and control chronic respiratory diseases. GARD is a voluntary alliance of national and international organizations and agencies from many countries committed to the vision of a world where all people breathe freely. Chronic obstructive pulmonary disease, COPD, is a chronic inflammatory lung disease that causes obstructed airflow from the lungs. Symptoms include breathing difficulty, cough, mucus, sputum, production and wheezing. It's typically caused by long-term exposure to irritating gases or particulate matter, most often from cigarette smoke. People with COPD are at increased risk of developing heart disease, lung cancer and a variety of other conditions. Emphysema and chronic bronchitis are the two most common conditions that contribute to COPD. These two conditions usually occur together and can vary in severity among individuals with COPD. Chronic bronchitis is inflammation of the lining of the bronchial tubes, which carry air to and from the air sacs, alveoli, of the lungs. It's characterized by daily cough and mucus, sputum, production. Emphysema is a condition in which the alveoli at the end of the smallest air passages, bronchioles, of the lungs are destroyed as a result of damaging exposure to cigarette smoke and other irritating gases and particulate matter. Although COPD is a progressive disease that gets worse over time, COPD is treatable. With proper management, most people with COPD can achieve good symptom control and quality of life, as well as reduced risk of other associated conditions. Symptoms. COPD symptoms often don't appear until significant lung damage has occurred, and they usually worsen over time, particularly if smoking exposure continues. Signs and symptoms of COPD may include shortness of breath, especially during physical activities, wheezing, chest tightness, a chronic cough that may produce mucus, sputum, that may be clear, white, yellow, or greenish, frequent respiratory infections, lack of energy, unintended weight loss, in later stages, swelling in ankles, feet or legs. People with COPD are also likely to experience episodes called exacerbations, during which their symptoms become worse than the usual day-to-day variation and persist for at least several days. When to see a doctor. Talk to your doctor if your symptoms are not improving with treatment or getting worse, or if you notice symptoms of an infection, such as fever or a change in sputum. Seek immediate medical care if you can't catch your breath, if you experience severe blueness of your lips or fingernail beds, cyanosis, or a rapid heartbeat, or if you feel foggy and have trouble concentrating. Causes. The main cause of COPD in developed countries is tobacco smoking. In the developing world, COPD often occurs in people exposed to fumes from burning fuel for cooking and heating in poorly ventilated homes. Only some chronic smokers develop clinically apparent COPD, although many smokers with long smoking histories may develop reduced lung function. Some smokers develop less common lung conditions. They may be misdiagnosed as having COPD until a more thorough evaluation is performed. How your lungs are affected. Air travels down your windpipe, trachea, and into your lungs through two large tubes, bronchi. Inside your lungs, these tubes divide many times, like the branches of a tree, into many smaller tubes, bronchioles, that end in clusters of tiny air sacs, alveoli. The air sacs have very thin walls full of tiny blood vessels, capillaries. The oxygen in the air you inhale passes into these blood vessels and enters your bloodstream. At the same time, carbon dioxide, a gas that is a waste product of metabolism, is exhaled. Your lungs rely on the natural elasticity of the bronchial tubes and air sacs to force air out of your body. COPD causes them to lose their elasticity and overexpand, which leaves some air trapped in your lungs when you exhale. Causes of airway obstruction. Causes of airway obstruction include emphysema. This lung disease causes destruction of the fragile walls and elastic fibers of the alveoli. Small airways collapse when you exhale, impairing airflow out of your lungs. Chronic bronchitis. In this condition, your bronchial tubes become inflamed and narrowed and your lungs produce more mucus, which can further block the narrowed tubes. You develop a chronic cough trying to clear your airways. Cigarette smoke and other irritants. In the vast majority of people with COPD, the lung damage that leads to COPD is caused by long-term cigarette smoking. But there are likely other factors at play in the development of COPD, such as a genetic susceptibility to the disease, because not all smokers develop COPD. Other irritants can cause COPD, including cigar smoke, secondhand smoke, pipe smoke, air pollution, and workplace exposure to dust, smoke or fumes. Alpha-1 antitrypsin deficiency. In about 1% of people with COPD, the disease results from a genetic disorder that causes low levels of a protein called alpha-1 antitrypsin, AAT. AAT is made in the liver and secreted into the bloodstream to help protect the lungs. Alpha-1 antitrypsin deficiency can cause liver disease, lung disease, or both. For adults with COPD related to AAT deficiency, treatment options include those used for people with more common types of COPD. In addition, some people can be treated by replacing the missing AAT protein, which may prevent further damage to the lungs. Risk factors. Risk factors for COPD include exposure to tobacco smoke. The most significant risk factor for COPD is long-term cigarette smoking. The more years you smoke and the more packs you smoke, the greater your risk. Pipe smokers, cigar smokers and marijuana smokers also may be at risk, as well as people exposed to large amounts of secondhand smoke. People with asthma. Asthma, a chronic inflammatory airway disease, may be a risk factor for developing COPD. The combination of asthma and smoking increases the risk of COPD even more. Occupational exposure to dusts and chemicals. Long-term exposure to chemical fumes, vapors and dusts in the workplace can irritate and inflame your lungs. Exposure to fumes from burning fuel. In the developing world, people exposed to fumes from burning fuel for cooking and heating in poorly ventilated homes are at higher risk of developing COPD. Genetics. The uncommon genetic disorder alpha-1 antitrypsin deficiency is the cause of some cases of COPD. Other genetic factors likely make certain smokers more susceptible to the disease. Complications. COPD can cause many complications, including respiratory infections. People with COPD are more likely to catch colds, the flu, and pneumonia. Any respiratory infection can make it much more difficult to breathe and could cause further damage to lung tissue. Heart problems. For reasons that aren't fully understood, COPD can increase your risk of heart disease, including heart attack. Lung cancer. People with COPD have a higher risk of developing lung cancer. High blood pressure in lung arteries. COPD may cause high blood pressure in the arteries that bring blood to your lungs, pulmonary hypertension. Depression. Difficulty breathing can keep you from doing activities that you enjoy. And dealing with serious illness can contribute to the development of depression. Prevention. Unlike some diseases, COPD typically has a clear cause and a clear path of prevention, and there are ways to slow the progression of the disease. The majority of cases are directly related to cigarette smoking, and the best way to prevent COPD is to never smoke or to stop smoking now. If you're a longtime smoker, these simple statements may not seem so simple, especially if you've tried quitting once, twice, or many times before. But keep trying to quit. It's critical to find a tobacco cessation program that can help you quit for good. It's your best chance for reducing damage to your lungs. Occupational exposure to chemical fumes and dusts is another risk factor for COPD. If you work with these types of lung irritants, talk to your supervisor about the best ways to protect yourself, such as using respiratory protective equipment. Here are some steps you can take to help prevent complications associated with COPD. Quit smoking to help reduce your risk of heart disease and lung cancer. Get an annual flu vaccination and regular vaccination against pneumococcal pneumonia to reduce your risk of or prevent some infections. Talk to your doctor if you feel sad or helpless or think that you may be experiencing depression. COPD is commonly misdiagnosed. Many people who have COPD may not be diagnosed until the disease is advanced. To diagnose your condition, your doctor will review your signs and symptoms, discuss your family and medical history, and discuss any exposure you've had to lung irritants, especially cigarette smoke. Your doctor may order several tests to diagnose your condition. Tests may include lung, pulmonary, function tests. These tests measure the amount of air you can inhale and exhale, and whether your lungs deliver enough oxygen to your blood. During the most common test, called spirometry, you blow into a large tube connected to a small machine to measure how much air your lungs can hold and how fast you can blow the air out of your lungs. Other tests include measurement of lung volumes and diffusing capacity, 6-minute walk test, and pulse oximetry. Chest X-ray. A chest X-ray can show emphysema, one of the main causes of COPD. An X-ray can also rule out other lung problems or heart failure. CT scan. A CT scan of your lungs can help detect emphysema and help determine if you might benefit from surgery for COPD. CT scans can also be used to screen for lung cancer. Arterial blood gas analysis. This blood test measures how well your lungs are bringing oxygen into your blood and removing carbon dioxide. Laboratory tests. Lab tests aren't used to diagnose COPD, but they may be used to determine the cause of your symptoms or rule out other conditions. For example, lab tests may be used to determine if you have the genetic disorder alpha-1 antitrypsin deficiency, which may be the cause of COPD in some people. This test may be done if you have a family history of COPD and develop COPD at a young age. Care at Mayo Clinic. Our caring team of Mayo Clinic experts can help you with your COPD-related health concerns. Start here. More information. COPD care at Mayo Clinic. Chest X-rays. CT scan. Show more related information. Treatment. Many people with COPD have mild forms of the disease for which little therapy is needed other than smoking cessation. Even for more advanced stages of disease, effective therapy is available that can control symptoms, slow progression, reduce your risk of complications and exacerbations, and improve your ability to lead an active life. Quitting smoking. The most essential step in any treatment plan for COPD is to quit all smoking. Stopping smoking can keep COPD from getting worse and reducing your ability to breathe. But quitting smoking isn't easy. And this task may seem particularly daunting if you've tried to quit and have been unsuccessful. Talk to your doctor about nicotine replacement products and medications that might help, as well as how to handle relapses. Your doctor may also recommend a support group for people who want to quit smoking. Also, avoid secondhand smoke exposure whenever possible. Medications. Several kinds of medications are used to treat the symptoms and complications of COPD. You may take some medications on a regular basis and others as needed. Bronchodilators. Bronchodilators are medications that usually come in inhalers. They relax the muscles around your airways. This can help relieve coughing and shortness of breath and make breathing easier. Depending on the severity of your disease, you may need a short-acting bronchodilator before activities, a long-acting bronchodilator that you use every day, or both. Examples of short-acting bronchodilators include albuterol, ProAir HFA, Ventolin HFA, others. Ipratropium, Atrovent HFA, levolbuterol, Xopenex. Examples of long-acting bronchodilators include aclidinium, Tudorza Pressair, arformoterol, Brovana, formoterol, Perforomist, indicaterol, Arcapta Neo inhaler, tiotropium, Spiriva, salmeterol, Ceravent, umeclidinium, Incruzalipta. Inhaled steroids. Inhaled corticosteroid medications can reduce airway inflammation and help prevent exacerbations. Side effects may include bruising, oral infections and hoarseness. These medications are useful for people with frequent exacerbations of COPD. Examples of inhaled steroids include fluticasone, Flovent HFA, budesonide, Pulmicort Flexhaler. Combination inhalers. Some medications combine bronchodilators and inhaled steroids. Examples of these combination inhalers include fluticasone and vilanterol, Brio ellipta, fluticasone, umeclidinium and vilanterol, Trelegy ellipta, formoterol and budesonide, Symbicort, salmeterol and fluticasone, Advair HFA, Airduo Digihaler, others. Combination inhalers that include more than one type of bronchodilator also are available. Examples of these include aclidinium and formoterol, Ducler Pressair, albuterol and ipratropium, Combivent Respimat, formoterol and glycopyrrolate, Bevespi Aerosphere, glycopyrrolate and indicaterol, Udibron, olidaterol and tiotropium, Stialto Respimat, umeclidinium and vilanterol, Anoro ellipta. Oral steroids. For people who experience periods when their COPD becomes more severe, called moderate or severe acute exacerbation, short courses, for example, 5 days, of oral corticosteroids may prevent further worsening of COPD. However, long-term use of these medications can have serious side effects, such as weight gain, diabetes, osteoporosis, cataracts and an increased risk of infection. Phosphodiesterase 4 inhibitors. A medication approved for people with severe COPD and symptoms of chronic bronchitis is roflumilast, Dalaresp, a phosphodiesterase 4 inhibitor. This drug decreases airway inflammation and relaxes the airways. Common side effects include diarrhea and weight loss. Theophylline. When other treatment has been ineffective or if cost is a factor, theophylline, alixiphylline, Theo24, Theocron, a less expensive medication, may help improve breathing and prevent episodes of worsening COPD. Side effects are dose-related and may include nausea, headache, fast heartbeat and tremor, so tests are used to monitor blood levels of the medication. Antibiotics. Respiratory infections, such as acute bronchitis, pneumonia and influenza, can aggravate COPD symptoms. Antibiotics help treat episodes of worsening COPD, but they aren't generally recommended for prevention. Some studies show that certain antibiotics, such as azithromycin, Zithromax, prevent episodes of worsening COPD, but side effects and antibiotic resistance may limit their use. Lung therapies. Doctors often use these additional therapies for people with moderate or severe COPD. Oxygen therapy. If there isn't enough oxygen in your blood, you may need supplemental oxygen. There are several devices that deliver oxygen to your lungs, including lightweight, portable units that you can take with you to run errands and get around town. Some people with COPD use oxygen only during activities or while sleeping. Others use oxygen all the time. Oxygen therapy can improve quality of life and is the only COPD therapy proved to extend life. Talk to your doctor about your needs and options. Pulmonary Rehabilitation Program. These programs generally combine education, exercise training, nutrition advice, and counseling. You'll work with a variety of specialists who can tailor your rehabilitation program to meet your needs. Pulmonary rehabilitation after episodes of worsening COPD may reduce readmission to the hospital, increase your ability to participate in everyday activities, and improve your quality of life. Talk to your doctor about referral to a program. In-home non-invasive ventilation therapy. Evidence supports in-hospital use of breathing devices such as bilevel positive airway pressure, BiPAP, but some research now supports the benefit of its use at home. A non-invasive ventilation therapy machine with a mask helps to improve breathing and decrease retention of carbon dioxide, hypercapnia, that may lead to acute respiratory failure and hospitalization. More research is needed to determine the best ways to use this therapy. Managing exacerbations. Even with ongoing treatment, you may experience times when symptoms become worse for days or weeks. This is called an acute exacerbation, and it may lead to lung failure if you don't receive prompt treatment. Exacerbations may be caused by a respiratory infection, air pollution, or other triggers of inflammation. Whatever the cause, it's important to seek prompt medical help if you notice a sustained increase in coughing or a change in your mucus, or if you have a harder time breathing. When exacerbations occur, you may need additional medications, such as antibiotics, steroids, or both, supplemental oxygen, or treatment in the hospital. Once symptoms improve, your doctor can talk with you about measures to prevent future exacerbations, such as quitting smoking, taking inhaled steroids, long-acting bronchodilators, or other medications, getting your annual flu vaccine, and avoiding air pollution whenever possible. Surgery. Surgery is an option for some people with some forms of severe emphysema who aren't helped sufficiently by medications alone. Surgical options include lung volume reduction surgery. In this surgery, your surgeon removes small wedges of damaged lung tissue from the upper lungs. This creates extra space in your chest cavity so that the remaining healthier lung tissue can expand and the diaphragm can work more efficiently. In some people, this surgery can improve quality of life and prolong survival. Endoscopic lung volume reduction, a minimally invasive procedure, has recently been approved by the U.S. Food and Drug Administration to treat people with COPD. A tiny one-way endobronchial valve is placed in the lung, allowing the most damaged lobe to shrink so that the healthier part of the lung has more space to expand and function. Lung transplant. Lung transplantation may be an option for certain people who meet specific criteria. Transplantation can improve your ability to breathe and to be active. However, it's a major operation that has significant risks, such as organ rejection, and you'll need to take lifelong immune-suppressing medications. Bulectomy. Large air spaces, bulli, form in the lungs when the walls of the air sacs, alveoli, are destroyed. These bulli can become very large and cause breathing problems. In a bulectomy, doctors remove bulli from the lungs to help improve airflow. Pneumonia is an infection that inflames the air sacs in one or both lungs. The air sacs may fill with fluid or pus, purulent material, causing cough with phlegm or pus, fever, chills, and difficulty breathing. A variety of organisms, including bacteria, viruses, and fungi, can cause pneumonia. Pneumonia can range in seriousness from mild to life-threatening. It is most serious for infants and young children, people older than age 65, and people with health problems or weakened immune systems. Products and services. Book, Mayo Clinic Family Health Book, 5th edition. Show more products from Mayo Clinic. Symptoms. The signs and symptoms of pneumonia vary from mild to severe, depending on factors such as the type of germ causing the infection, and your age and overall health. Mild signs and symptoms often are similar to those of a cold or flu, but they last longer. Signs and symptoms of pneumonia may include chest pain when you breathe or cough, confusion or changes in mental awareness in adults age 65 and older, cough, which may produce phlegm, fatigue, fever, sweating and shaking chills. Lower than normal body temperature, in adults older than age 65 and people with weak immune systems. Nausea, vomiting or diarrhea. Shortness of breath. Newborns and infants may not show any sign of the infection. Or they may vomit, have a fever and cough, appear restless or tired and without energy, or have difficulty breathing and eating. When to see a doctor? See your doctor if you have difficulty breathing, chest pain, persistent fever of 102F, 39C, or higher, or persistent cough, especially if you're coughing up pus. It's especially important that people in these high-risk groups see a doctor. Adults older than age 65. Children younger than age 2 with signs and symptoms. People with an underlying health condition or weakened immune system. People receiving chemotherapy or taking medication that suppresses the immune system. For some older adults and people with heart failure or chronic lung problems, pneumonia can quickly become a life-threatening condition. Causes. Many germs can cause pneumonia. The most common are bacteria and viruses in the air we breathe. Your body usually prevents these germs from infecting your lungs. But sometimes these germs can overpower your immune system, even if your health is generally good. Pneumonia is classified according to the types of germs that cause it and where you got the infection. Community-acquired pneumonia. Community-acquired pneumonia is the most common type of pneumonia. It occurs outside of hospitals or other healthcare facilities. It may be caused by bacteria. The most common cause of bacterial pneumonia in the U.S. is Streptococcus pneumoniae. This type of pneumonia can occur on its own or after you've had a cold or the flu. It may affect one part, lobe, of the lung, a condition called lobar pneumonia. Bacteria-like organisms. Mycoplasma pneumoniae also can cause pneumonia. It typically produces milder symptoms than do other types of pneumonia. Walking pneumonia is an informal name given to this type of pneumonia, which typically isn't severe enough to require bed rest. Fungi. This type of pneumonia is most common in people with chronic health problems or weakened immune systems, and in people who have inhaled large doses of the organisms. The fungi that cause it can be found in soil or bird droppings and vary depending upon geographic location. Viruses, including COVID-19. Some of the viruses that cause colds and the flu can cause pneumonia. Viruses are the most common cause of pneumonia in children younger than 5 years. Viral pneumonia is usually mild. But in some cases it can become very serious. Coronavirus 2019, COVID-19, may cause pneumonia, which can become severe. Hospital-acquired pneumonia. Some people catch pneumonia during a hospital stay for another illness. Hospital-acquired pneumonia can be serious because the bacteria causing it may be more resistant to antibiotics and because the people who get it are already sick. People who are on breathing machines, ventilators, often used in intensive care units, are at higher risk of this type of pneumonia. Healthcare-acquired pneumonia. Healthcare-acquired pneumonia is a bacterial infection that occurs in people who live in long-term care facilities or who receive care in outpatient clinics, including kidney dialysis centers. Like hospital-acquired pneumonia, healthcare-acquired pneumonia can be caused by bacteria that are more resistant to antibiotics. Aspiration pneumonia. Aspiration pneumonia occurs when you inhale food, drink, vomit or saliva into your lungs. Aspiration is more likely if something disturbs your normal gag reflex, such as a brain injury or swallowing problem, or excessive use of alcohol or drugs. Risk factors. Pneumonia can affect anyone. But the two age groups at highest risk are children who are 2 years old or younger, people who are age 65 or older. Other risk factors include being hospitalized. You're at greater risk of pneumonia if you're in a hospital intensive care unit, especially if you're on a machine that helps you breathe, a ventilator. Chronic disease. You're more likely to get pneumonia if you have asthma, chronic obstructive pulmonary disease, COPD, or heart disease. Smoking. Smoking damages your body's natural defenses against the bacteria and viruses that cause pneumonia. Weakened or suppressed immune system. People who have HIV/AIDS, who've had an organ transplant, or who receive chemotherapy or long-term steroids are at risk. Complications. Even with treatment, some people with pneumonia, especially those in high-risk groups, may experience complications, including bacteria in the bloodstream, bacteremia. Bacteria that enter the bloodstream from your lungs can spread the infection to other organs, potentially causing organ failure. Difficulty breathing. If your pneumonia is severe or you have chronic underlying lung diseases, you may have trouble breathing in enough oxygen. You may need to be hospitalized and use a breathing machine, ventilator, while your lung heals. Fluid accumulation around the lungs, pleural effusion. Pneumonia may cause fluid to build up in the thin space between layers of tissue that line the lungs and chest cavity, pleura. If the fluid becomes infected, you may need to have it drained through a chest tube or removed with surgery. Lung abscess. An abscess occurs if pus forms in a cavity in the lung. An abscess is usually treated with antibiotics. Sometimes, surgery or drainage with a long needle or tube placed into the abscess is needed to remove the pus. Prevention. To help prevent pneumonia, get vaccinated. Vaccines are available to prevent some types of pneumonia and the flu. Talk with your doctor about getting these shots. The vaccination guidelines have changed over time, so make sure to review your vaccination status with your doctor even if you recall previously receiving a pneumonia vaccine. Make sure children get vaccinated. Doctors recommend a different pneumonia vaccine for children younger than age 2 and for children ages 2 to 5 years who are at particular risk of pneumococcal disease. Children who attend a group child care center should also get the vaccine. Doctors also recommend flu shots for children older than 6 months. Practice good hygiene. To protect yourself against respiratory infections that sometimes lead to pneumonia, wash your hands regularly or use an alcohol-based hand sanitizer. Don't smoke. Smoking damages your lungs' natural defenses against respiratory infections. Keep your immune system strong. Get enough sleep, exercise regularly, and eat a healthy diet. Your doctor will start by asking about your medical history and doing a physical exam, including listening to your lungs with a stethoscope to check for abnormal bubbling or crackling sounds that suggest pneumonia. If pneumonia is suspected, your doctor may recommend the following tests. Blood tests. Blood tests are used to confirm an infection and to try to identify the type of organism causing the infection. However, precise identification isn't always possible. Chest X-ray. This helps your doctor diagnose pneumonia and determine the extent and location of the infection. However, it can't tell your doctor what kind of germ is causing the pneumonia. Pulse oximetry. This measures the oxygen level in your blood. Pneumonia can prevent your lungs from moving enough oxygen into your bloodstream. Sputum test. A sample of fluid from your lungs, sputum, is taken after a deep cough and analyzed to help pinpoint the cause of the infection. Your doctor might order additional tests if you're older than age 65, are in the hospital, or have serious symptoms or health conditions. These may include CT scan. If your pneumonia isn't clearing as quickly as expected, your doctor may recommend a chest CT scan to obtain a more detailed image of your lungs. Pleural fluid culture. A fluid sample is taken by putting a needle between your ribs from the pleural area and analyzed to help determine the type of infection. More information. Chest X-rays. Treatment. Treatment for pneumonia involves curing the infection and preventing complications. People who have community-acquired pneumonia usually can be treated at home with medication. Although most symptoms ease in a few days or weeks, the feeling of tiredness can persist for a month or more. Specific treatments depend on the type and severity of your pneumonia, your age, and your overall health. The options include antibiotics. These medicines are used to treat bacterial pneumonia. It may take time to identify the type of bacteria causing your pneumonia and to choose the best antibiotic to treat it. If your symptoms don't improve, your doctor may recommend a different antibiotic. Cough medicine. This medicine may be used to calm your cough so that you can rest. Because coughing helps loosen and move fluid from your lungs, it's a good idea not to eliminate your cough completely. In addition, you should know that very few studies have looked at whether over-the-counter cough medicines lessen coughing caused by pneumonia. If you want to try a cough suppressant, use the lowest dose that helps you rest. Fever reducers/pain relievers. You may take these as needed for fever and discomfort. These include drugs such as aspirin, ibuprofen, Advil, Motrin IB, others, and acetaminophen, Tylenol, others. Hospitalization. You may need to be hospitalized if you are older than age 65. You are confused about time, people, or places. Your kidney function has declined. Your systolic blood pressure is below 90 mm of mercury, mmHg, or your diastolic blood pressure is 60 mm of mercury or below. Your breathing is rapid, 30 breaths or more a minute. You need breathing assistance. Your temperature is below normal. Your heart rate is below 50 or above 100. You may be admitted to the intensive care unit if you need to be placed on a breathing machine, ventilator, or if your symptoms are severe. Children may be hospitalized if they are younger than age 2 months. They are lethargic or excessively sleepy. They have trouble breathing. They have low blood oxygen levels. They appear dehydrated. Lifestyle and home remedies. These tips can help you recover more quickly and decrease your risk of complications. Get plenty of rest. Don't go back to school or work until after your temperature returns to normal and you stop coughing up mucus. Even when you start to feel better, be careful not to overdo it. Because pneumonia can recur, it's better not to jump back into your routine until you are fully recovered. Ask your doctor if you're not sure. Stay hydrated. Drink plenty of fluids, especially water, to help loosen mucus in your lungs. Take your medicine as prescribed. Take the entire course of any medications your doctor prescribed for you. If you stop taking medication too soon, your lungs may continue to harbor bacteria that can multiply and cause your pneumonia to recur. Preparing for your appointment. You may start by seeing a primary care doctor or an emergency care doctor, or you may be referred to a doctor who specializes in infectious diseases or in lung disease, pulmonologist. Here's some information to help you get ready for your appointment and know what to expect. What you can do. Keep a record of any symptoms, including your temperature. Write down key medical information, including recent hospitalizations and any medical conditions you have. Write down key personal information, including exposure to any chemicals or toxins, or any recent travel. Make a list of all medications, vitamins, and supplements that you're taking, especially an antibiotic left over from a previous infection, as this can lead to a drug-resistant pneumonia. Bring a family member or friend along, if possible, to help you remember questions to ask and what your doctor said. Write down questions to ask the doctor. Some basic questions to ask the doctor include: what is likely causing my symptoms? What kinds of tests do I need? What treatment do you recommend? Will I need to be hospitalized? I have other health conditions. How will my pneumonia affect them? Are there any restrictions that I need to follow? Don't hesitate to ask other questions. What to expect from the doctor. Be ready to answer questions your doctor may ask. When did you first start having symptoms? Have you had pneumonia before? If so, in which lung? Have your symptoms been continuous or occasional? How severe are they? What, if anything, seems to improve or worsen your symptoms? Have you traveled or been exposed to chemicals or toxic substances? Have you been exposed to sick people at home, school, or work? Do you smoke? Or have you ever smoked? How much alcohol do you consume in a week? Have you had flu or pneumonia vaccines? What you can do in the meantime. To avoid making your condition worse. Don't smoke or be around smoke. Drink plenty of fluids and get plenty of rest. What is a chest cold, acute bronchitis? A chest cold, often called acute bronchitis, occurs when the airways of the lungs swell and produce mucus in the lungs. That's what makes you cough. Acute bronchitis can last less than 3 weeks. Causes. A virus usually causes acute bronchitis. Bacteria can sometimes cause acute bronchitis. But, even in these cases, taking antibiotics is not advised and will not help you get better. Symptoms. Symptoms of acute bronchitis last less than 3 weeks and can include coughing with or without mucus, soreness in the chest, feeling tired, fatigue, mild headache, mild body aches, sore throat. On this page. What is a chest cold, acute bronchitis? Causes. Symptoms. When to seek medical care. Treatment. How to feel better. Over-the-counter medicine and children. Prevention. This image depicts the difference between a healthy lung air passage and an unhealthy lung air passage. Swelling of airways in the lungs produce mucus in the lungs and makes you cough. View larger. Top of page. When to seek medical care. Talk to a healthcare professional right away if your child is under 3 months old with a fever of 100.4 degrees Fahrenheit 38 degrees Celsius or higher. See a doctor if you have any of the following. Temperature of 100.4 degrees Fahrenheit or higher. Cough with bloody mucus. Shortness of breath or trouble breathing. Symptoms that last more than 3 weeks. Repeated episodes of bronchitis. This list is not all-inclusive. Please see a doctor for any symptom that is severe or concerning. Top of page. Treatment. What antibiotics treat and won't treat. What antibiotics treat and won't treat. Transcript, TXT, 294b. Acute bronchitis usually gets better on its own without antibiotics. Antibiotics won't help you get better if you have acute bronchitis. When antibiotics aren't needed, they won't help you, and their side effects could still cause harm. Side effects can range from mild reactions, like a rash, to more serious health problems. These problems can include severe allergic reactions, antibiotic-resistant infections, and C. diff infection. C. diff causes diarrhea that can lead to severe colon damage and death. Other illnesses like whooping cough, pertussis, or pneumonia can have similar symptoms to acute bronchitis. If you have whooping cough or pneumonia, your doctor will most likely prescribe antibiotics. How to feel better. Below are some ways you can feel better while your body fights off acute bronchitis. Get plenty of rest. Drink plenty of fluids. Use a clean humidifier or cool mist vaporizer. Use saline nasal spray or drops to relieve a stuffy nose. For young children, use a rubber suction bulb to clear mucus. Breathe in steam from a bowl of hot water or shower. Suck on lozenges. Do not give lozenges to children younger than 4 years of age. Use honey to relieve cough for adults and children at least 1 year of age or older. Ask your doctor or pharmacist about over-the-counter medicines that can help you feel better. Always use over-the-counter medicines as directed. Remember, over-the-counter medicines may provide temporary relief of symptoms, but they will not cure your illness. Top of page. Over-the-counter medicine and children. Carefully read and follow instructions on over-the-counter medicine product labels before giving medicines to children. Some over-the-counter medicines are not recommended for children of certain ages. Pain relievers. Children younger than 6 months, only give acetaminophen. Children 6 months or older, it is okay to give acetaminophen or ibuprofen. Never give aspirin to children because it can cause Reye's syndrome. Reye's syndrome is a very serious, but rare illness that can harm the liver and brain. Cough and cold medicines. Children younger than 4 years old, do not use over-the-counter cough and cold medicines in young children unless a doctor specifically tells you to. Cough and cold medicines can result in serious and sometimes life-threatening side effects in young children. Children 4 years or older, discuss with your child's doctor if over-the-counter cough and cold medicines are safe to give to your child. Ask your doctor or pharmacist about the right dosage of over-the-counter medicines for your child's age and size. Also, tell your child's doctor and pharmacist about all prescription and over-the-counter medicines they are taking. Top of page. Prevention. You can help prevent acute bronchitis by doing your best to stay healthy and keep others healthy, including clean your hands. Get recommended vaccines, such as the flu vaccine. Don't smoke and avoid secondhand smoke. Cover your mouth and nose when coughing or sneezing. Common cold. Sneezing, stuffy and runny nose? You might have a cold. Colds are one of the most frequent reasons for missed school and work. Every year, adults have an average of 2 to 3 colds, and children have even more. Antibiotics do not work against viruses that cause colds and will not help you feel better. Causes. More than 200 viruses can cause a cold, but rhinoviruses are the most common type. Viruses that cause colds can spread from person to person through the air and close personal contact. Risk factors. Many factors can increase your risk of catching a cold, including close contact with someone who has a cold. Season. Colds are more common during the fall and winter, but it is possible to get a cold any time of the year. Age. Infants and young children have more colds per year than adults. Symptoms. Symptoms of a cold usually peak within 2 to 3 days and can include sneezing, stuffy nose, runny nose, sore throat, coughing, mucus dripping down your throat, postnasal drip, watery eyes, fever, although most people with colds do not have fever. When viruses that cause colds first infect the nose and sinuses, the nose makes clear mucus. This helps wash the viruses from the nose and sinuses. After 2 or 3 days, mucus may change to a white, yellow, or green color. This is normal and does not mean you need an antibiotic. Some symptoms, especially runny or stuffy nose and cough, can last for up to 10 to 14 days. Those symptoms should improve over time. When to seek medical care. See a doctor if you have trouble breathing or fast breathing, dehydration, fever that lasts longer than 4 days, symptoms that last more than 10 days without improvement, symptoms such as fever or cough that improve but then return or worsen, worsening of chronic medical conditions. This list is not all-inclusive. Please see a doctor for any symptom that is severe or concerning. Colds can have similar symptoms to flu. It can be difficult, or even impossible, to tell the difference between them based on symptoms alone. Learn more about differences between cold and flu. Common cold symptoms. Anatomy of the nasal cavity, pointing out symptoms of the common cold. When you have a cold, mucus fills your nose and could cause postnasal drip, headache, and a sore throat. Resize view larger. How long will symptoms last with a typical cold? Symptoms of a cold can last 8 to 14 days or more. Resize view larger. When you have a cold, a sore throat could last for 8 days. A headache could last for 9 or 10 days. Congestion, runny nose, and cough could last for more than 14 days. Baby, talk to a healthcare professional right away if your child is under 3 months old with a fever of 100.4 degrees Fahrenheit 38 degrees Celsius or higher. Read more, colds versus flu. Top of page. Treatment. Your doctor can determine if you have a cold by asking about symptoms and examining you. Your doctor may also need to order laboratory tests. There is no cure for a cold. It will get better on its own without antibiotics. Antibiotics won't help you get better if you have a cold. When antibiotics aren't needed, they won't help you, and their side effects could still cause harm. Side effects can range from mild reactions, like a rash, to more serious health problems. These problems can include severe allergic reactions, antibiotic-resistant infections, and C. diff infection. C. diff causes diarrhea that can lead to severe colon damage and death. Viruses or bacteria? What's got you sick? Virus or bacteria? What's got you sick? Image. How to feel better. Below are some ways you can feel better while your body fights off a cold. Get plenty of rest. Drink plenty of fluids. Use a clean humidifier or cool mist vaporizer. Use saline nasal spray or drops. For young children, use a rubber suction bulb to clear mucus. Breathe in steam from a bowl of hot water or shower. Use throat lozenges or cough drops. Do not give lozenges to children younger than 4 years of age. Use honey to relieve cough for adults and children at least 1 year of age or older. Ask your doctor or pharmacist about over-the-counter medicines that can help you feel better. Always use over-the-counter medicines as directed. Remember, over-the-counter medicines may provide temporary relief of symptoms, but they will not cure your illness. Top of page. Over-the-counter medicine and children. Carefully read and follow instructions on over-the-counter medicine product labels before giving medicines to children. Some over-the-counter medicines are not recommended for children of certain ages. Pain relievers. Children younger than 6 months, only give acetaminophen. Children 6 months or older, it is okay to give acetaminophen or ibuprofen. Never give aspirin to children because it can cause Reye's syndrome. Reye's syndrome is a very serious, but rare illness that can harm the liver and brain. Cough and cold medicines. Children younger than 4 years old, do not use over-the-counter cough and cold medicines in young children unless a doctor specifically tells you to. Cough and cold medicines can result in serious and sometimes life-threatening side effects in young children. Children 4 years or older, discuss with your child's doctor if over-the-counter cough and cold medicines are safe to give to your child. Ask your doctor or pharmacist about the right dosage of over-the-counter medicines for your child's age and size. Also, tell your child's doctor and pharmacist about all prescription and over-the-counter medicines they are taking. Top of page. Prevention. You can help prevent colds by doing your best to stay healthy and keep others healthy, including: clean your hands. Avoid close contact with people who have colds or other upper respiratory infections. Cover your mouth and nose when coughing or sneezing. Avoid touching your eyes, nose, and mouth with unwashed hands. Don't smoke and avoid secondhand smoke. Stay at home while you are sick and keep children out of school or daycare while they are sick. Ear infection. Is your child's ear hurting? It could be an ear infection. Children are more likely than adults to get ear infections. Talk to your child's doctor about the best treatment. Some ear infections, such as middle ear infections, need antibiotic treatment, but many can get better without antibiotics. What is an ear infection? There are different types of ear infections. Middle ear infection, acute otitis media, is an infection in the middle ear. Another condition that affects the middle ear is called otitis media with effusion. This condition occurs when fluid builds up in the middle ear without causing an infection. Otitis media with effusion does not cause fever, ear pain, or pus buildup in the middle ear. Swimmer's ear is an infection in the outer ear canal. Swimmer's ear is different from a middle ear infection. For more information, visit swimmer's ear, otitis externa. Causes. Bacteria or viruses can cause a middle ear infection. Bacteria, like Streptococcus pneumoniae and Haemophilus influenza, non-typable, are the 2 most common bacteria causing middle ear infection. Viruses, like those that cause colds, can cause middle ear infection. Symptoms. Common symptoms of middle ear infection in children can include Ear pain, fever, fussiness or irritability, rubbing or tugging at an ear, difficulty sleeping. When to seek medical care. See a doctor if your child has a fever of 102.2 degrees Fahrenheit 39 degrees Celsius or higher, pus, discharge or fluid coming from the ear, worsening symptoms. Symptoms of a middle ear infection that last for more than 2 to 3 days. Hearing loss. This list is not all-inclusive. Please see a doctor for any symptom that is severe or concerning. On this page. What is an ear infection? Causes. Symptoms. When to seek medical care. Treatment. How to feel better. Over-the-counter medicine and children. Prevention. Healthy ear/infection of middle ear. Anatomy of the ear showing where fluid builds up in the middle ear and puts pressure, or pushes, on the ear. A healthy ear including outer, middle, and inner ear. An infected ear showing inflammation and fluid in the ear. View larger. What antibiotics treat and won't treat. What antibiotics treat and won't treat. Transcript, TXT, 294b. Talk to a healthcare professional right away if your child is under 3 months old with a fever of 100.4 degrees Fahrenheit 38 degrees Celsius or higher. Treatment. A doctor can diagnose a middle ear infection by asking about symptoms and examining your child. The doctor will look inside your child's ear to examine the eardrum and look for pus in the middle ear. The body's immune system can often fight off middle ear infection on its own. Antibiotics are sometimes not needed for middle ear infections. However, severe middle ear infections or infections that last longer than 2 to 3 days need antibiotics right away. For mild middle ear infection, your doctor might recommend watchful waiting or delayed antibiotic prescribing. Watchful waiting, your child's doctor may suggest watching and waiting for 2 to 3 days to see if your child needs antibiotics. This gives the immune system time to fight off the infection. If your child's symptoms don't improve, the doctor may prescribe an antibiotic. Delayed prescribing, your child's doctor may prescribe an antibiotic but suggest that you wait 2 to 3 days before filling the prescription. Your child may recover on their own and may not need the antibiotic. Top of page. How to feel better. Below are some ways to feel better, even if antibiotics are needed for an ear infection. Rest. Extra water or other fluids. Over-the-counter medicines to relieve pain or fever. Ask your doctor or pharmacist about over-the-counter medicines that can help you feel better. Always use over-the-counter medicines as directed. Top of page. Over-the-counter medicine and children. Carefully read and follow instructions on over-the-counter medicine product labels before giving medicines to children. Some over-the-counter medicines are not recommended for children of certain ages. Pain relievers. Children younger than 6 months, only give acetaminophen. Children 6 months or older, it is okay to give acetaminophen or ibuprofen. Never give aspirin to children because it can cause Reye's syndrome. Reye's syndrome is a very serious, but rare illness that can harm the liver and brain. Cough and cold medicines. Children younger than 4 years old, do not use over-the-counter cough and cold medicines in young children unless a doctor specifically tells you to. Cough and cold medicines can result in serious and sometimes life-threatening side effects in young children. Children 4 years or older, discuss with your child's doctor if over-the-counter cough and cold medicines are safe to give to your child. Ask your doctor or pharmacist about the right dosage of over-the-counter medicines for your child's age and size. Also, tell your child's doctor and pharmacist about all prescription and over-the-counter medicines they are taking. Top of page. Prevention. You can help prevent ear infections by doing your best to stay healthy and keep others healthy, including receive recommended vaccines, such as flu vaccine and pneumococcal vaccine. Pneumococcal vaccine protects against a common cause of middle ear infections, Streptococcus pneumonia. Clean your hands. Breastfeed exclusively until your baby is 6 months old and continue to breastfeed for at least 12 months. Don't smoke and avoid exposure to secondhand smoke. Dry your ears thoroughly after swimming. What is flu? Flu is a respiratory illness that spreads from person to person. It can cause mild to severe illness. Serious outcomes of flu can result in hospitalization or death. Some people, such as older people, young children, pregnant women, and people with certain health conditions, are at high risk of serious flu complications. Causes. Flu is caused by a virus that is spread from person to person. It causes seasonal epidemics each year. Symptoms. Flu symptoms can occur suddenly. You might have the flu if you have some or all of these symptoms. Fever, not everyone with flu will have a fever. Cough, body aches, sore throat, runny or stuffy nose, headache, chills, fatigue, sometimes diarrhea and vomiting. Complications. Most people who get flu will recover in a few days to less than 2 weeks. But some people will develop complications, such as pneumonia, as a result of flu, some of which can be life-threatening and result in death. Moderate complications of flu include sinus infections, ear infections. Possible serious complications triggered by flu can include lung infection, pneumonia, inflammation of the heart, brain, or muscle, organ failure, for example, respiratory and kidney failure, sepsis, which can be deadly. Flu also can make chronic medical problems worse. For example, if you have asthma, flu may trigger asthma attacks. If you have chronic heart disease, flu may make your condition worse. On this page, what is flu? Causes, symptoms, complications, when to seek medical care, treatment, prevention. For more information, see people at high risk of developing flu-related complications. When to seek medical care. These are the emergency warning signs of flu sickness. In children, fast breathing or trouble breathing, bluish lips or face, ribs pulling in with each breath, chest pain, severe muscle pain, child refuses to walk, dehydration, no urine for 8 hours, dry mouth, no tears when crying, not alert or interacting when awake. Seizures, fever above 104 degrees Fahrenheit. In children less than 12 weeks old, any fever or cough that improve but then return or worsen. Worsening of chronic medical conditions. Top of page. These are not all of the possible emergency warning signs of flu. Contact your doctor about any other symptoms that are severe or concerning. If you have the emergency warning signs of flu sickness, you should obtain medical care right away. In adults, difficulty breathing or shortness of breath, persistent pain or pressure in the chest or abdomen, persistent dizziness, confusion, inability to arouse, seizures, not urinating, severe muscle pain, severe weakness or unsteadiness, fever or cough that improve but then return or worsen, worsening of chronic medical conditions. High-risk group. If you have symptoms of flu and are in a high-risk group, or are very sick or worried about your illness, contact your doctor. High-risk groups include young children, children with neurologic conditions, pregnant women, adults 65 years and older, anyone with these conditions, asthma, heart disease, stroke, diabetes, HIV/AIDS, cancer. Top of page. Treatment. Your doctor might prescribe antiviral drugs for flu. These drugs can make you better faster and may also prevent serious complications. If you are in a high-risk group and develop flu symptoms, you need to contact your doctor when you first notice flu symptoms. Remind them about your high-risk status for flu. See treatment, antiviral drugs for more information. Antiviral drugs need to be taken within 2 days of your first flu symptoms. Antibiotics won't help. When you have flu, antibiotics will not help you feel better. Antibiotics won't help you, and their side effects could cause harm. Side effects of antibiotics can range from minor issues, like a rash, to very serious health problems, such as antibiotic-resistant infections, which are difficult to treat and cure. C. Diff infection, which causes severe diarrhea that can lead to severe colon damage and death. If you use over-the-counter medicines, take them as directed. Remember, over-the-counter medicines may provide temporary relief of symptoms, but they will not cure your illness. Antibiotics won't help if you have flu. Viruses or bacteria. What's got you sick? Virus or bacteria. What's got you sick? Image icon. Over-the-counter medicine and children. Be careful about giving over-the-counter medicines to children. Not all over-the-counter medicines are recommended for children of certain ages. Pain relievers. Children younger than 6 months, only give acetaminophen. Children 6 months or older, acetaminophen or ibuprofen can be given. Cough and cold medicines. Children younger than 4 years old, do not use unless specifically directed by a doctor. Use of over-the-counter cough and cold medicines in young children can result in serious and potentially life-threatening side effects. Children 4 years or older, discuss with your child's doctor if over-the-counter cough and cold medicines are safe to give to your child for temporary symptom relief. Be sure to ask your doctor or pharmacist about the right dosage of over-the-counter medicines for your child's age and size. Also, tell your child's doctor and pharmacist about all prescription and over-the-counter medicines they are taking. Never give aspirin to children younger than 19 years old. Aspirin can cause Reye syndrome, a rare but very serious illness that harms the liver and brain. Prevention. The best way to prevent flu is by getting vaccinated with the flu vaccine each year. Other ways to avoid flu. Try to avoid contact with sick people. If you are sick, limit contact with others as much as possible to keep from infecting them. Cover your nose and mouth with a tissue when you cough or sneeze. After using a tissue, throw it in the trash and wash your hands. Wash your hands often with soap and water. If soap and water are not available, use an alcohol-based hand rub. Avoid touching your eyes, nose, and mouth. Germs spread this way. Clean and disinfect surfaces and objects that may be contaminated with germs like flu. Sinus infection, sinusitis. Stuffy nose that just isn't getting better? You might have a sinus infection, also called sinusitis. Antibiotics are not needed for many sinus infections, but your doctor can decide if you need an antibiotic. Causes. Sinus infections happen when fluid builds up in the air-filled pockets in the face, sinuses. This fluid buildup allows germs to grow. Viruses cause most sinus infections, but bacteria can cause some sinus infections. Risk factors. Several factors can increase your risk of getting a sinus infection. A previous cold. Seasonal allergies. Smoking and exposure to secondhand smoke. Structural problems within the sinuses. For example, growths on the lining of the nose or sinuses, known as nasal polyps. A weak immune system or taking drugs that weaken the immune system. Symptoms. Common symptoms of sinus infections include runny nose, stuffy nose, facial pain or pressure, headache, mucus dripping down the throat, postnasal drip, sore throat, cough, bad breath. On this page. Causes. Risk factors. Symptoms. When to seek medical care. Treatment. How to feel better. Over-the-counter medicine and children. Prevention. Sinus infection. Sinus infection. When you have a sinus infection, one or more of your sinuses becomes inflamed. Fluid builds up, which can cause congestion and runny nose. View larger. Talk to a healthcare professional right away if your child is under 3 months old with a fever of 100.4 degrees Fahrenheit 38 degrees Celsius or higher. When to seek medical care. See a doctor if you have severe symptoms, such as severe headache or facial pain. Symptoms that get worse after improving. Symptoms lasting more than 10 days without getting better. Fever longer than 3 to 4 days. You should also seek medical care if you have had multiple sinus infections in the past year. This list is not all-inclusive. Please see a doctor for any symptom that is severe or concerning. Other conditions can cause symptoms similar to a sinus infection, including seasonal allergies, colds. Treatment. Your doctor will determine if you have a sinus infection by asking about symptoms and examining you. Antibiotics are not needed for many sinus infections. Most sinus infections usually get better on their own without antibiotics. When antibiotics aren't needed, they won't help you, and their side effects could still cause harm. Side effects can range from mild reactions, like a rash, to more serious health problems. These problems can include severe allergic reactions, antibiotic-resistant infections, and C. diff infection. C. diff causes diarrhea that can lead to severe colon damage and death. However, in some cases, you may need antibiotics. Talk to your doctor about the best treatment for your illness. For some sinus infections, your doctor might recommend watchful waiting or delayed antibiotic prescribing. Watchful waiting, your doctor may suggest watching and waiting for 2 to 3 days to see if you need antibiotics. This gives the immune system time to fight off the infection. If your symptoms don't improve, the doctor may prescribe an antibiotic. Delayed prescribing, your doctor may prescribe an antibiotic but suggest that you wait 2 to 3 days before filling the prescription. You may recover on your own and may not need the antibiotic. What antibiotics treat and won't treat. What antibiotics treat and won't treat. Transcript, TXT, 294b. How to feel better. Below are some ways to help relieve sinus pain and pressure. Put a warm compress over the nose and forehead to help relieve sinus pressure. Use a decongestant or saline nasal spray. Breathe in steam from a bowl of hot water or shower. Ask your doctor or pharmacist about over-the-counter medicines that can help you feel better. Always use over-the-counter medicines as directed. Top of page. Visit sinus rinsing for health or religious practice for information on how to safely use a sinus rinse. Over-the-counter medicine and children. Carefully read and follow instructions on over-the-counter medicine product labels before giving medicines to children. Some over-the-counter medicines are not recommended for children of certain ages. Pain relievers. Children younger than 6 months, only give acetaminophen. Children 6 months or older, it is okay to give acetaminophen or ibuprofen. Never give aspirin to children because it can cause Reye's syndrome. Reye's syndrome is a very serious, but rare illness that can harm the liver and brain. Cough and cold medicines. Children younger than 4 years old, do not use over-the-counter cough and cold medicines in young children unless a doctor specifically tells you to. Cough and cold medicines can result in serious and sometimes life-threatening side effects in young children. Children 4 years or older, discuss with your child's doctor if over-the-counter cough and cold medicines are safe to give to your child. Ask your doctor or pharmacist about the right dosage of over-the-counter medicines for your child's age and size. Also, tell your child's doctor and pharmacist about all prescription and over-the-counter medicines they are taking. Top of page. Prevention. You can help prevent sinus infections by doing your best to stay healthy and keep others healthy, including: clean your hands. Receive recommended vaccines, such as the flu vaccine and pneumococcal vaccine. Avoid close contact with people who have colds or other upper respiratory infections. Don't smoke and avoid secondhand smoke. Use a clean humidifier to moisten the air at home. Sore throat. Is it painful to swallow? Or is your throat scratchy? A virus may be causing your sore throat. Most sore throats, except for strep throat, do not need antibiotics. Causes. Causes of sore throat include viruses, like those that cause colds or flu. The bacteria group A strep, which causes strep throat, also called streptococcal pharyngitis. Allergies. Smoking or exposure to secondhand smoke. Of these, infections from viruses are the most common cause of sore throats. Strep throat is an infection in the throat and tonsils caused by bacteria. These bacteria are called group A streptococcus, also called streptococcus pyogenes. Symptoms of sore throat. A sore throat can make it painful to swallow. A sore throat can also feel dry and scratchy. Sore throat can be a symptom of strep throat, the common cold, allergies, or other upper respiratory tract illness. Sore throat caused by a virus or the bacteria called group A streptococcus can have similar symptoms. Sometimes the following symptoms suggest a virus is causing the illness instead of strep throat. Cough. Runny nose. Hoarseness, changes in your voice that makes it sound breathy, raspy, or strained. Conjunctivitis, also called pink eye. Symptoms of strep throat. In general, strep throat is a mild disease, but it can be very painful. Common symptoms may include fever, pain when swallowing, sore throat that can start very quickly and may look red and swollen tonsils, white patches or streaks of pus on the tonsils, tiny, red spots on the roof of the mouth, called petechiae, swollen lymph nodes in the front of the neck. The following symptoms suggest a virus is causing the illness instead of strep throat. Cough, runny nose, hoarseness, changes in your voice that makes it sound breathy, raspy, or strained. Conjunctivitis, also called pink eye. When to seek medical care. Talk to your doctor if you or your child have symptoms of sore throat. They may need to test you or your child for strep throat. Also see a doctor if you or your child have any of the following: difficulty breathing, difficulty swallowing, blood and saliva or phlegm, excessive drooling in young children, dehydration, joint swelling and pain, rash. This list is not all-inclusive. Please see your doctor for any symptom that is severe or concerning. See a doctor if symptoms do not improve within a few days or get worse. Tell your doctor if you or your child have recurrent sore throats. Treatment. A doctor will determine what type of illness you have by asking about symptoms and doing a physical examination. Sometimes they will also swab your throat. On this page. Causes. Symptoms of sore throat. Symptoms of strep throat. When to seek medical care. Treatment. How to feel better. Over-the-counter medicine and children. Prevention. A virus causes the most common type of sore throat and is not strep throat. Only 3 in 10 children with a sore throat have strep throat. Only about 1 in 10 adults with a sore throat has strep throat. Sore throat. Anatomy of the mouth, showing inflamed tonsils in a sore throat. A healthy throat and a sore throat, including uvula and tongue, showing inflamed tonsils. View larger. More about Scarlet fever. Strep throat. Talk to a healthcare professional right away if your child is under 3 months old with a fever of 100.4 degrees Fahrenheit 38 degrees Celsius or higher. Viruses or bacteria? What's got you sick? Virus or bacteria? What's got you sick? More about rheumatic fever. Since bacteria cause strep throat, antibiotics are needed to treat the infection and prevent rheumatic fever and other complications. A doctor cannot tell if someone has strep throat just by looking in the throat. If your doctor thinks you might have strep throat, they can test you to determine if it is causing your illness. Anyone with strep throat should stay home from work, school, or daycare until they no longer have fever and have taken antibiotics for at least 12 hours. If a virus causes a sore throat, antibiotics will not help. Most sore throats will get better on their own within 1 week. Your doctor may prescribe other medicine or give you tips to help you feel better. More about antibiotic-resistant infections. C. diff. When antibiotics aren't needed, they won't help you, and their side effects could still cause harm. Side effects can range from mild reactions, like a rash, to more serious health problems. These problems can include severe allergic reactions, antibiotic-resistant infections, and C. diff infection. C. diff causes diarrhea that can lead to severe colon damage and death. How to feel better. Some ways you can feel better when you have a sore throat. Suck on ice chips, popsicles, or lozenges. Do not give lozenges to children younger than 2 years. Use a clean humidifier or cool mist vaporizer. Gargle with salt water. Drink warm beverages and plenty of fluids. Use honey to relieve cough for adults and children at least 1 year of age or older. Ask your doctor or pharmacist about over-the-counter medicines that can help you feel better. Always use over-the-counter medicines as directed. Top of page. Over-the-counter medicine and children. Carefully read and follow instructions on over-the-counter medicine product labels before giving medicines to children. Some over-the-counter medicines are not recommended for children of certain ages. Pain relievers. Children younger than 6 months, only give acetaminophen. Children 6 months or older, it is okay to give acetaminophen or ibuprofen. Never give aspirin to children because it can cause Reye's syndrome. Reye's syndrome is a very serious, but rare illness that can harm the liver and brain. Cough and cold medicines. Children younger than 4 years old, do not use over-the-counter cough and cold medicines in young children unless a doctor specifically tells you to. Cough and cold medicines can result in serious and sometimes life-threatening side effects in young children. Children 4 years or older, discuss with your child's doctor if over-the-counter cough and cold medicines are safe to give to your child. Ask your doctor or pharmacist about the right dosage of over-the-counter medicines for your child's age and size. Also, tell your child's doctor and pharmacist about all prescription and over-the-counter medicines they are taking. Top of page. Prevention. You can help prevent sore throats by doing your best to stay healthy and keep others healthy, including clean your hands. Avoid close contact with people who have sore throats, colds, or other upper respiratory infections. Don't smoke and avoid exposure to secondhand smoke.